Hi there, Dr. Grant Blashki from familydoctor.expert. Today I'm going to talk about maintaining mental health as a university student. Now this might seem like a very specific topic, but as an academic at the university, I've been struck by a pattern of students stressing out, having mental health troubles, and I was surprised to read, or not surprised in a way, in the newspaper today that a recent study found that 7 out of 10 university students described their mental health as either fair or poor. And I thought, wow, this is a lot of not happy people. So why is it occurring? Hard to know exactly, although there's a few things that seem to be at play. Obviously there's the academic workload, and universities are very competitive and competitive to get in. I think some of the new university students have to adapt to the fact that there's a complete lack of structure compared to what they're used to at school. So you're very much left to fend for yourself at a lot of the universities. I think there are financial pressures on a lot of students. They're working part-time jobs. There are vocational concerns about what sort of jobs are going to be available at the end of all the hard work. I think some of the students, certainly in the sorts of courses that I'm teaching, have sort of existential concerns. So they're hearing about very sort of big issues, global health issues or climate change, environmental issues, political issues. It feels like the world's changing a lot at the moment, so they're trying to get their head around that. And then my other theory, for which I don't have lots of evidence, is that a lot of students have their minds working overtime. They're either on their laptops or playing on their phones, and they don't really get much of a break. I think there's some particular students at risk. I mean, the universities have very much become an international industry in a sense, and we have students coming from all around the world. They're supported to some extent, but still it can be quite isolating being in a new country, being at a new university, different place, and all the accompanying difficulties of settling in. Other people that are probably particularly at risk are people who've had a past history of mental health problems. If you've had trouble when you're at school, you're probably a little bit more risk to run into trouble at university as well. Family history of mental health issues, we know in general that can also increase your risk. So there's obviously a spectrum. I mean, at one end you just have normal stress, and we don't want to medicalise everything. We don't want to say everybody that's got a bit of stress therefore is depressed and needs to go on antidepressants tomorrow. That would be silly. But there are a lot of people who are experiencing quite severe stress. A bit further down the line we have people who are having what we would call a mental illness, so they do get depression or anxiety, or in my experience they usually get a bit of a combination. Many of the students are using recreational drugs. I feel very old-fashioned when I'm in the clinic and I'm saying, listen, you really shouldn't be taking these, but it seems to me that it's extremely common to be using ecstasy, MDMA every few weekends or few months. A lot of students are smoking a lot of marijuana. So, we'll talk about that, but I think for people who are having mental health problems, it's probably not a good idea to be tipping up your brain chemicals in that way. So what can you do? So the first things you can do are just some common sense, what I sort of call lifestyle things. So think about your university workload. Work out if you've taken on too much, particularly if you're trying to do part-time job on top of everything. Speak to a university counsellor if there's anything you can do with your workload. There's some simple things. Healthy eating, getting lots of exercise is really good for stress management. As I mentioned, avoid drug and alcohol binging. Probably doesn't help. You might have a great night, but it does seem to tip things up. Try and get enough sleep. Be careful with how much caffeine you're having. If you're having lots and lots of coffee and Coke and really revving yourself up with caffeine, you're not going to be able to sleep. And then also I think there's something very healthy about structuring your time. So we do have this sort of boundaryless existence at the moment where you've got university information popping into your phone, Instagram, Snapchat, social networks, all that stuff. Have a think about having a 24-hour period once a week where you actually just turn it off. bit of a challenge, bit hard to do. Now, the next thing to think about is getting educated about what's going on, and there's some great websites out there. I'm particularly fond of the Beyond Blue website. It's got some great fact sheets about all sorts of things, different sorts of fact sheets about anxiety, about depression, about managing stress, lots of things there. So once you've done all that, you're still struggling a little bit, what can you do? Well, there's lots to be learned from psychology, and there's some fantastic strategies that you can use. At the moment, mindfulness is very fashionable. I think it actually has a lot of evidence behind it as well. It's very good for people where their mind is working overtime. There's a free app called Smiling Mind, which I think is fantastic, and you can work through the exercises and try and do even just 5 minutes every morning and night, and it'll really help you manage your stress at university. Now, if you're still having trouble, it might be worth going and speaking either to a university counsellor or maybe going to a psychologist. Now, many of the university students, they're not in a financial situation to go and pay for a whole lot of psychology appointments, but you should be aware of a couple of good pathways. If you go to a GP, the GP can fill out what's called a GP mental health plan. Usually only takes about 20 or 30 minutes. They'll get you to fill out a little survey as well, and they'll be able to recommend a psychologist. Now, if you're under pressure cash-wise, they could send you to Headspace that doesn't charge people under the age of 26. So that's a really good option. And there are other mental health services within Headspace as well. So that's well worth being aware of. Now, psychologists can talk to you about lots of different things. One technique that I've been really impressed with that they use is called cognitive behavioural therapy, or what we call CBT. Now, that approach particularly looks at the patterns of thinking that you're getting into, and university students are often hyper analytical and are thinking, and they often fall into some pretty common traps with their thinking. So one of the types of thinking that they get involved in is what we call black and white thinking. So this sort of dichotomous thinking is that self-talk where you're saying to yourself, listen, I'm either going to get a HD, I'm either an absolutely brilliant student, or I'm terrible. And what you want to be doing is thinking more in shades of grey, so that you're saying, well, I did okay in that subject and that's okay. So really just easing up on yourself a bit in terms of black and white thinking. Very commonly when people are getting a bit anxious or depressed, they get into self-blame thinking, so that they think, you know, if they've got a bad result or they're failing a subject, it's all their fault, and they can pay out on themselves pretty hard. And there might be more complexity to that. They might be having trouble with language, maybe it's not a great tutor, maybe it's not a great teacher, maybe it was an unfair test, who knows. But the point is to recognise that sort of self-blame talk that's hard on yourself. Sometimes people get into what we call catastrophizing. And with catastrophizing, usually a small event happens and people go down a whole spiral of negative thinking. So they might get one bad exam result and they go, oh my gosh, I've got a bad exam result. I'm probably going to fail the subject, and then I'll get kicked out of the university, and then I won't get a job. Then my parents will be unhappy, etc., etc. So they'll go down a whole negative pathway. It varies for different people. So it's well worth being aware of that tendency to catastrophize. Now, for people that are getting a bit caught up with the really existential ideas of it's the end of the world, and you're studying some pretty intense subjects at the university, what I recommend is that you try and keep perspective. Yes, there are big issues that we need to deal with, but don't lose the big picture. When my parents were born, there was the middle of Second World War, the world was completely in chaos. Or go back 100 years, we had huge numbers of people in poverty. And so whilst it's important to work on these important social justice issues, don't get them out of perspective that historically humanity is actually doing very well in a whole lot of fields. And it's a very exciting time to be contributing to these pursuits. So there's other sorts of sort of what we call faulty thinking that people get into, and there's something you could talk about with a psychologist, but it can be really helpful. Now, if you're having more serious troubles, there are other things that we can do. Sometimes if people have anxiety and depression, they do benefit from going on a dose of antidepressants for a few months, and that's something you could talk about with your doctor. Just a bit of a caveat, if you're really getting down in the dumps and feel like you're having suicidal thoughts, thinking about harming yourself, spending a lot of time ruminating what the world would be like without you here, that's a pretty serious thing. You need to get help for that. You need to speak to a psychologist or a GP, and there's also a number of emergency hotlines, suicide helplines. So, if you're getting into that sort of headspace, very important to get help immediately. Now, other things you can do are relationships. Try to not be too isolated at the university. Join some clubs, get to know some friends. I would recommend, if you're someone who's a bit of a loner and you don't have many connections at the university, make a really conscious effort to get involved in a few of the clubs and get to know some other people. So, there's a few tips there. As with all these videos, they don't replace going to the doctor. Don't take any decisions, or don't consider that this is instead of going and getting professional help. So I wish you well, and I hope you enjoy your university time.